Dear students, now I'm going to discuss about the topic known as hypersensitivity. So, hypersensitivity is a type of reaction. It's an immunological reaction, and during an immune response, the release of inflammatory mediators results in increased vascular permeability and recruitment of inflammatory cells to cause local tissue damage or local tissue inflammation. This particular reaction describes tissue damage secondary to an uh, exaggerated inflammatory reaction. These reactions may be in response to an external antigenic challenges such as pollens, uh, like in hay fever, and inappropriate response to a pathogen or even to an individual's own tissue. Under certain conditions, however, the inflammatory response can have deleterious effect, resulting in significant tissue injury, serious disease, or even death. So hypersensitivity reaction denotes an immunological reactions resulting in exaggerated or inappropriate reactions harmful to host. This particular reaction involves both humoral as well as cell-mediated immune systems, and the two scientists, Potier and Richet, suggested that a toxin to be responsible for these effects and coined the term anaphylaxis. So hypersensitivity reaction essentially has two components. The first dose, or which is known as the primary dose of antigen, is essential, which is required to prime the immune system, followed by the secondary dose, which is known as the stocking dose of the same antigen that results in the injurious consequences or injurious consequences. So hypersensitivity reactions can be described by the Gill and Holmes classification. And depending on the time taken for the reaction and the mechanism that cause the tissue damage, hypersensitivity can broadly classified into two types: immediate type and delayed type. But Gill and Holmes in 1963 has classified that hypersensitivity reactions are four types based on the time elapsed from the exposure of antigen to the reaction and the arm of immune system involved. So they have classified type 1, type 2, type 3 antibody or antibody mediated hypersensitivity reaction, and that they are known as the immediate hypersensitivity reactions. Whereas type 4 is a cell-mediated one and is known as the delayed type of hypersensitivity reaction. So this classification it classifies the reactions depending on their time scale and etiology, producing four separate groups. Although the classes are apparently independent of each other, and hypersensitivity reactions often involve more than one of the reactions at any one time. So type 1 to 3, they are antibody mediated, and type 4, this is cell mediated immune response. But as per Gill and Holmes, type 1, here the mediator is IgE, immunoglobulin E, and in rare cases IgG4 can act. And the reaction type is immediate reaction types. In case of type 2 reactions, here IgG, IgM are taking place and the reaction mode is cytotoxic. In case of type 3 hypersensitivity reaction, the mediator is antigen antibody complexes, and here the reaction type is immune complex formation. In case of type 4, that is cell mediated, T-cell based, T-cell mediated immunological responses, and the reaction type is cell mediated. So now I'm coming to type 1 hypersensitivity reaction. So type 1 hypersensitivity reaction is the most common type of reaction, which is known as the allergic reactions mediated by IgE. So these particular reactions are known as immediate reactions and are seen in anaphylaxis, allergic asthma, eczema. In order to be at risk of type 1 hypersensitivity, an individual must have been sensitized to an antigen by an earlier exposure. So first exposure that may be in the form of ingestion, inhalation, injection, or direct contact, that will produce an immunoglobulin E specific to that antigen, and the memory for that IgE is then held within the plasma cell repertoire. Then hypersensitivity results when subsequent exposure to the antigen induces large-scale production of IgE, which bind to the Fc receptor of the mast cell. The interaction of the mast cell bound IgE with their antigen induces degranulation and release of inflammatory mediators. So if you look into the reaction scheme, here you will see this is the first exposure and the production of IgE, and the second exposure with a similar antigen is a degranulation of the mast cell. So mast cell granules contain histamine. When they degranulate, histamine release causes increased vascular permeability and vasodilation, which contribute to the immediate effect seen in type 1 hypersensitivity reactions. Other factors, other mediators can also take place here, can also release by the degranulation, are chemotactic factors which are responsible for drawing in circulating eosinophils and basophils and platelet activating factors, which further contributes to the vascular changes seen in this particular reaction. Now, what are anaphylaxis reactions? So, anaphylaxis reaction or anaphylactic reactions, most type 1 reaction occurs locally as a result of IgE production to inhaled or ingested antigens, as is seen with the pollens or food allergies. So anaphylaxis is a dramatic example of a type 1 hypersensitivity reaction that results from the systemic administration of an antigen. So the time course of anaphylaxis depends on the route of antigen delivery. If antigen is delivered systematically to a sensitized individual, for example, through a bee sting or an intravenous drugs, anaphylaxis ensures rapid. So when antigen is absorbed through the skin or gastrointestinal tract, the onset of anaphylactic symptoms may be slower for example, with latex or peanut allergy. Next, I'm coming to the initiators. So these are the initiators. So here you can see these beings, then the insects as well as the pollens. They are functioning here as an initiator of anaphylaxis reaction. So type 2 hypersensitivity reaction. This is a cytotoxic type of immunological reaction. So here you will see that in type 2 hypersensitivity reaction, these are categorized as antibody-mediated reaction, where IgG and IgM are taking place. So both the antibodies are functioning as a mediator. Here, IgM and IgG immunoglobulin reacts with the cell surface antigen to activate the complement system and to produce direct damage of the cell surface. In transfusion reaction, hemolytic diseases of the newborn, in case of erythroblastoma fetalis. So these are the examples of type 2 hypersensitivity reaction. So here you will see first this is the target cell. Surface antigen will be identified by the antibody. It will form the antigen antibody complex, and here the B cell that is actually producing the immunoglobulin against that native cell are not deleted during development. When this occurs, individuals are at risk of autoimmune disease, including organ-specific diseases or hemolytic anemias. So an example of organ-specific autoimmune disease due to type 2 hypersensitivity is Good-Pastor's syndrome. In these conditions, antibodies are produced against type 4 collagen found on the basement membrane of the lung and glomerulus, and the binding antibodies to collagen induces inflammation and subsequent damage to the basement membrane, rendering it to non-functional. So this is an example of how this is functioning. Here they are actually involving the complement system. So this is a complement mediated, and at last you will see the activation of the membrane. They will attack the membrane, and there will be osmotic lysis or else phagocytosis of the complex. Then I'm coming to the type 3 hypersensitivity reaction. Here, type 3 hypersensitivity reaction occurs following the deposition of immune complexes. So it's an antigen-antibody complexation reaction. And this results in complement activation and inflammation. For this reason, they are also known as immune complex mediated hypersensitivity reactions. And in health, antigen-antibody complexes are maintained as soluble immune complexes in the blood by complement protein C2 and C4. These immune complexes bind to complement receptors on the RBC, allowing their transport to the spleen where complexes are removed and destroyed. So if the production of immune complexes is greater than the clearance, then it will develop pathology, pathology may arise. So when there is excessive production of immune complex, precipitation may occur, and this precipitation will lead to complement activation, recruitment of immune cells and tissue damage through release of inflammatory mediators as well as the free radicals. And the subsequent areas will be affected by the immune complex precipitation tends to be the sites for inflammation, or that may be function as a site for filtration, such as the glomeruli, such as synovium or epidermal basement membrane. In case of some individual, they have the higher predisposition to type 3 hypersensitivity, and this can be due to the inherited tendencies or pre-existing disease causes. Inherited tendencies are due to C2 or C4 complement protein deficiency, which causes increased precipitation due to reduced complement complex solubility. So SLE disease, systemic lupus erythematosus, is an example of this kind of type 3 hypersensitivity reaction. So this reaction may take 3 to 4 hours after the exposure of the antigen in case of RS reaction. So this is the mechanism of type 3 hypersensitivity reaction. So antigen will bind with the B cells, and then the plasma cell will produce antibody, and when the second exposure antigen will come, it will form the complex, and this will activate the complement system as well as the immune cells, neutrophils. So both will result tissue damage or inflammation. So type 3 hypersensitivity reaction is an immune complex mediated hypersensitivity reaction. Here they are resulting in inflammation or tissue injury, and these reactions are of two types. One is a local reaction, which is known as the Arthur's reaction. Another one is the systemic reaction, that is known as the serum sickness. So here in Arthur's reaction, this is named by Dr. Arthur, who has discovered this disease. Here, the inflammation is caused by the deposition of the immune complex at a localized site. So, pneumonitis is one kind of example of anticipation. Serum sickness means it's throughout the body, it's a systematic reaction. So, develops due to deposition of the immune complexes at many areas of the body. So, a few days to two weeks after injection or of the foreign serum or drug, resulting this type of sickness, and the symptoms of fever, eosinophilia, splenomegaly, like that. So there are four type of immune means type 3 hypersensitivity reaction or immune complex diseases. One is hypersensitivity pneumonitis, glomerulonephritis, rheumatoid arthritis, and systemic lupus erythematosus. So here, this is only because hypersensitivity pneumonitis is only because of inhalation of the antigen. So it will deposit into the lungs. The complex will deposit into the lungs, and subsequent inhalation of the same antigen, and it will activate the complement system, and it will damage the alveoli of the lungs. Next one is the glomerulonephritis. So this is only because of the infection, presence of the immune complex in blood. So here the glomerulus is functioning as a filtration unit, so it will be deposited there and will subsequently activate the complement pathway, and will result in renal failure and ultimately death. Rheumatoid arthritis is another example of type 3 hypersensitivity reaction. Here the immune complex deposited in the joint, and it results in release of inflammatory and chemicals. The joint began to break down, and it will deform itself. And this particular type of reactions or the disease have no such treatment. So only anti-inflammatory drugs are used to relieve the pain. Last one is SLE disease. So this is an autoimmune disease against DNA, resulting in immune complex formation. So many other autoantibodies can also occur here against the red blood cells, platelets, lymphocytes, muscle cells, like that. And how it has triggered within the body, it is still unknown. Some immune suppressive drugs may reduce this autoantibody formation, but only the drugs can be used as the glucocorticoids. They are used to reduce the inflammation. Then type 4 hypersensitivity reactions, delayed types of and cell-mediated type hypersensitivity reaction. So this particular delayed type or cell-mediated type hypersensitivity reaction, here they have involved the T lymphocyte, but the T cells, specific T cells. So these reactions may take up up to 12 hours for features to develop, and therefore it is known as delayed type hypersensitivity. And typically these reactions occur following contact of sensitizing antigen with the skin, where the effects are seen as contact dermatitis. In this process, antigen is taken up by the local innate immune cells such as the macrophages, and these cells then act as antigen presenting cells and activate the antigen specific CD4 T cells. Then T cells activated in this manner tend to adopt a T1 profile and migrate to the area of high antigenic load, where they release inflammatory cytokines such as interferon gamma, interleukin 1, 2, and 6. The result of the cytokines is local inflammation through an increase in vascular permeability or further immune cell migration and activation. So here in type 4 hypersensitivity reaction, it can be activated by T lymphocytes by release of this and T cell mediated cytokines. So this is the pathogenesis of type 4 hypersensitivity reaction. It has two phases. One is the sensitization phase, another one is the effector phase. Here the stimulus coming in the form of bacteria, say mycobacterium, tuberculosis, virus, or fungus. So when the stimulus coming, they are identified by the antigen presenting cells, mostly by the macrophages. Then they are activating the T helper cell 1, And these T helper cell 1, they are releasing some pro-inflammatory cytokines, and then they are inducing the effector cells here, TH1 is releasing interferon gamma or the interleukins, and then by activating the macrophages as well as the association with the association with MHC2 class 2 proteins. So they are activating the macrophages and then releasing the antigen antibody or the antigen. So here, this is the mechanism of pathogenesis of type 4 hypersensitivity. So one of the example is the tuberculin test here. Tuberculin is a toxin we are injecting the skin, just beneath the skin, causes reaction in individual exposed to tuberculosis or tuberculosis vaccine. So this particular test is used to diagnose contact with antigen of Mycobacterium tuberculosis, and if no response is there, then the individual not infected or he or she has been vaccinated already. And if the area is reddened, hard swelling developed in the individual after administration of tuberculin, then we can say that it has previously infected or immunized. Another one is allergic contact dermatitis. Is also a cell-mediated immune response, results in the intensity of irritating skin rashes, and it is triggered by chemically modified skin proteins that the body regards as foreign. So this particular test is a cellular fluid-like blisters develop in severe cases, and it can be treated by only by using glucocorticoids. Then graft rejection. So rejection of tissues or organs in transplantation process, so kidney transplantation, liver transplantation. The graft perceived as foreign by the recipient undergo rejection. An immune response against this foreign MHC on the graft cells took place. This rejection depends on degree to which the graft is foreign to the recipient, and it is based on the type of graft. There are four types of grafts. One is known as autograft, isograft, allograft, and xenograft. So an allograft is a transplanted organ or tissue from a genetically non-identical member of the same species. In the most human tissues or organ transplant, these are the allograft. In contrast to that, a transplanted organ or tissue from a genetically identical donor, that is from the identical twin, is known as the isograft. Means it is genetically identical donor, but siblings are the clone. And while the transplant means a transplant from another species is termed as a xenograft. So this is a different species. It's termed as xenograft. When a tissue is transplanted from one site to another on the same patient, such as a skin graft or a tissue flap, is known as, as autograft. So allograft and xenograft will be recognized by the recipient immune system as foreign, and will therefore be attacked in a process termed as rejection. And this doesn't occur in autograft or true isograft, which is most of the cases, that is 100% genetically identical. So that's all.